Hi, Allie. How are you doing today?
I'm doing well. How are you?
Good. She's been moving?
Yeah, she has been. She's kicking like crazy.
Good. Any concerns that you have at all?
The one thing I wanted to talk about this visit is at night I've been noticing when I try to go to sleep, it's like I cannot fall asleep because my itching in my hands and feet is so crazy. It's keeping me awake at night.
Okay. And it's mostly at night that you're noticing it?
Yeah, it gets a lot worse at night.
Okay. And
definitely.
It just started for you? Or is it been
I would
going on?
say it's gotten worse over the past like maybe week or two.
Okay.
Yeah.
Okay. Any other symptoms? Any nausea? Any pain, especially kind of right under your ribs on the side?
I guess there's been some pain up there. I didn't know if she was kicking or not, but it has been a little sore. Yeah.
Okay. I mean, some of this can be normal in pregnancy, but with the itching, especially worse at night, there's something that we want to screen you for, and it's something called Cholestasis of Pregnancy. So it's something that we'll do a blood test, and that's how we check for it. And it's a liver condition, and it can happen in pregnancy.
Oh, a liver condition. That sounds pretty serious.
So it's not really serious for moms. So it's only in pregnancy, and then after pregnancy, it usually goes away.
Okay.
But the main concern is we worry a little bit more about the baby.
Will she be okay?
So, most likely she will be fine. So there's a couple increased risks with cholestasis. There's a slightly increased risk of preterm labor.
Okay.
And then the big scary one that I hate even mentioning, since we don't even know that it's cholestasis yet, but there is a small increased risk of stillbirth.
Oh, wow. That's pretty serious.
So it's, very rare that it happens. If it ends up being cholestasis, there's some treatments that we'll do. There's a medication that we put you on that in some women lowers their bile acids. It hasn't been proven to be able to prevent stillbirth, but we do think that it has some really beneficial effects for helping protect the baby. So with kind of medication and some of the other treatments, that has helped lower her risk down to that of a normal pregnancy pretty much.
Okay. Will it change the course of the pregnancy at all?
So there's a couple of things that we would do differently. So we'd monitor your blood levels of those bile acids, which we would measure to diagnose it. So we'd follow those. We'd also do some kind of extra monitoring, some extra ultrasounds. And then the big difference for you is, you were expecting her to come at a certain time.
Yeah.
She probably would be coming a little early. So we usually deliver around 37 weeks with cholestasis. And that's just to kind of protect her and get her here safely.
Oh, absolutely. I would love to get her here safely.
So, all right.
All right. Well, thank you so much. I'm glad I brought that up.
Yeah.
I was just being dramatic.
No, nothing's dramatic. I'm glad you brought it up too. So next step, we'll do the blood work. That usually takes a couple days to come back, and then I'll give you a phone call and we'll discuss kind of further what we're doing. Okay.
Sounds good. Thank you so much.
Right,
I appreciate it.
Sounds good.
Yes,
All right.
thank you.
So that was just an example of a physician-patient encounter. If you would like more information or more resources that you can use to either take back to your physician or learn more about ICP, we welcome you to go to our webpage at icpcare.org, and that has a wealth of information for you.